didn't feel like it would go anywhere if I did. Like I just feel like my story wouldn't be valid enough. And there's so much you need these days to be able to actually do anything about anything for good reasons too. But just for sometimes it doesn't really help you out.
Not really. I mean, I did it just as I would have done any sort of like assault thing. I just called the police straight away and then called the hospital, went to the hospital. Um, but the hospital, and I mean, I spoke to 111, I spoke to the GP, I spoke to the pharmacy, and I spoke to the hospital, and all four of them had completely different protocols for it. I think I've heard from other people that they've been told to go to A&E straight away because then they could have the HIV PEP treatment, which needs to be done straight away. But I went to the GP, I think, 3 days afterwards, and it wasn't enough time to get that treatment. And they were like, you should have gone to A&E straight away. But then obviously I'd been told otherwise. So it's just very confusing. They tell someone to go somewhere and then there's no protocol in place to where to go first. Obviously they say go to a healthcare professional, but not which one. If it happened again, I think I would go straight to A&E. Um, if they would take it seriously, I don't know, but I think I would get angry enough so that they would. But hopefully, I think I would ask. A lot of places say that they don't do it, but I would ask for the PEP treatment just in case, just because it's just peace of mind, the fact that you won't get HIV, because that shouldn't even be on your mind when this is all happening. Um, but that was my biggest fear through it. I was just like, I don't want to get any diseases because bloodborne diseases are so much more complicated and harder to treat. Um, so that was my biggest fear. So I would go straight to A&E, ask for PEP. But the thing is, I don't know if they would say yes, if they would say that's the wrong thing to do, send me somewhere else. But that's what I would do. And then I would go to the police again, like I did last time. I did an online form. I was with my friend May, and we had to spend the night in the hospital because she'd been spiked. Um, but I don't really understand what happened because it's so hard to prove. I mean, the drug test sample came back negative again, but also I'll show you the cups. Well, they're these little cups, and they even like use them in the hospital. And they're the most like they're not very reliable whatsoever. So they use these for every single case that happens, and I don't think they're reliable at all. I think they're like the equivalent of like a lateral flow COVID test, and I don't think they're used in the best way because as soon as that came back negative, I mean, she was unconscious about 10 times, and she was like foaming at the mouth. She was having seizures. The paramedics had to take her to the hospital. I was in the car with them. Um, but when we were there, as soon as the drug test sample came back negative, they just discharged her. So they use that as their like sole, I don't know, like evidence. But obviously, it's not very trustworthy, and I think that's why a lot of cases go ignored.
When a patient presents at the emergency department after being spiked, we assess them to determine whether they're safe. We assess whether they're maintaining their own airway and they're not going to vomit and block off that airway. And then we continue to assess them and determine where we can see them in the department. So sometimes that might be in the resuscitation area because that's the safest place for them to be. Other times that might be in the main department. We take bloods on the patient and check that they're all normal. And then we keep them safe and allow them to recover naturally from that process. And once they're in a position where they can make their own decisions, we encourage them to report it to the police, and then the police follow up on that. The police can request our bloods, and from those bloods they'll be able to determine if there is anything.
There's numerous different signs to spot with a person who's had their drink spiked, and I think really the best thing to be able to explain that is for you to probably interview people who've been spiked, because then they can tell you exactly what happened, because it all depends on the size of the person, the weight of the person, how much alcohol they've drunk, were they a recreational drug user. So there's a lot of if and buts to that answer, to be honest.
The main way we determine whether someone's been spiked is we look at how they're presenting. So it's very, very difficult because some of the drugs that make you have less consciousness also are very, very similar to the way you would be if you had too much alcohol. Some of the other medications, such as ketamine, lowers your inhibitions and changes your behavior. That's a little bit easier to recognize. But other drugs such as GHB, that's very difficult because you become incredibly unconscious, and there's many other reasons for that. So by doing bloods, we can formally recognize what's in their blood. So if you think you've been spiked, but you don't realize this until the next day when you wake up, the police are always there. You can contact the police, and they have a process where they will investigate this, and if needs be, they can take blood samples. They can also do urine samples as well, because the drugs get excreted that way. And they'll still be able to follow up the process. Just because you've waited 12, 24 hours doesn't detract from this has happened, and it still gets investigated. If you think somebody's been spiked, then you might be seeing that they have got a lower level of consciousness, so they're more sleepy than you're expecting them to be. They might have acutely changed their behavior, acting in a way that you weren't expecting them to be, and acting in a way that is not normal for them. And if you were to suspect that, then the best thing you can do for them is to take that person to a safe place, somewhere where they can relax and allow the drug to wear off. But the main thing is just keep them in a safe environment, and that could be the emergency department, or that could be at home. So if you think you've been spiked on a night out, you need to find yourself a safe place to be. So to call a friend, and if a friend isn't available to come and collect you and take you home to a safe place, then the next best thing you can do is call 999, and the ambulance service will come and see you, and they'll take you to a place of safety. That advice about being spiked and being taken to a safe place, it's not just on a night out, it can be anywhere. So at a festival, there is medical providers there, and they offer the same service. They have their own ambulances, they have their medical centres, and they will take you to a place of safety, assess you, and then allow you to recover naturally.
So if you personally think you've had your drink spiked, you've got a really small window to get to help. So you need to go and speak to a trusted friend, get to a trusted member of staff or security staff. You need to tell them that you've had your drink spiked and that they need to get you to a place of safety, and not to leave you alone with anybody that you don't know. Maybe call your parents, call your husband, your wife, whoever it may be. You need to get to a place of safety as quickly as possible. So we always recommend that you go straight to the police, because the police are the people who are going to be instructing the hospital to take bloods or urine sample so that they can get evidence to help to get a conviction. So we would recommend that people always report drink spiking incidents to the police. So if you're out on a night out and your friend got their drink spiked, then we would recommend going straight to the venue, telling them, the security or the bar staff in the venue, telling them what's happened. I would keep the drink so we could keep that as evidence, and also make sure that the venue would keep any CCTV of whoever was around my friend or myself if it happened to me. I would inform the police straight away. As soon as the police come, then we would either, depending on the victim, what was happening to them at that time, if they were conscious or unconscious, then we would go to the hospital. Then the hospital, we would ask them to take their bloods or urine sample so that we could have proof in case we needed that for a conviction.
We do sometimes see cases where people have put drugs in people's drinks just to see their reaction. So they might give them ketamine or MDMA just to see how they react, just to humiliate that person. So they have an acute change in behavior on a night out and act in a way that they wouldn't normally.
Honestly, I think the rise in spiking, especially like in October of last year, was mainly because everyone had just come out of lockdown. And I don't know, it makes people a little bit crazy, but it's mainly men who do it. Well, boys of my age. I think the student union is one of the biggest places it happens. And I don't completely understand it, but it's obviously like either with the intent to take a girl home and rape them or sexually assault them, or some people I think do it just to play tricks on people. Because I know a few boys have been spiked as well, and that's been like as a result of just like a trick or like a joke or something like that. It's like, what were you wearing that night? Were you with your friends? Did you have a rape alarm on you? Did you walk in groups? Did you do this? Did you that? But again, that's not like, people have come out with the intent to harm someone. Whether I was wearing something or doing something, that wouldn't change their intent, and that wouldn't change what would have happened. So instead of saying like, that person needs to change and they need to be educated, it's all on the victim, on the girl, telling them that they need to change, and they're the reason that they've been spiked. And I think I've got that from lots of people. Or they say, oh, you were just too drunk, you don't know what you're talking about, that sort of thing. So they just they either ignore it and dismiss it, or they do victim blame, and they don't focus the attention on the actual perpetrator. I'm so angry about it, I'm like, I shouldn't stop going out because these people are doing it. So I think that's my mindset. Yeah, I mean, I've seen lots of things online, like pages on Instagram, where they're like, how to prevent being spiked. And it's like, wear long sleeved, travel in packs, use a drink stopper, and that sort of thing. But that also, those are like most of the big campaigns on spiking. And I'm just thinking, when I was reading them, I was like, why are they still like targeting at women? Like, we shouldn't have to, although we do all those things. Like, I did that when I went on my night out. I was wearing long sleeves. I was with my friends all night. It was a practically empty club. I was covering my drink with my thumb because they didn't have drink stoppers. So there wasn't anything else I could have done. I didn't even feel the needle going in my arm. And then the next day I realized I'd been spiked. But there's nothing more I could have done myself which would have changed the outcome of the night. So I think the attitudes need to change from focusing on the people that have been spiked and the people who are actually spiking others. I think I just got angrier and angrier, and I obviously like wrote that letter and sent it to a few people. And then the responses that I all got from that letter were amazing. From the MP, she was really supportive and she took me really seriously. So did my university, and people like that. So I have to help other people because so many people don't want to come forward and they don't have the evidence or proof to do it. And I don't know, I just feel like I have to help in some way.
The main advice we give people is not to leave drinks unattended, not to accept drinks off people that they don't know and don't trust, and to stay safe with a group of friends. If you're out in a group of friends and something happens, then you know those people are going to be able to look after you and get you home to a safe place.
I think more like venue awareness, because at the end of the day, people are going to get drugs. They're going to sneak them in. There's no way you can prevent that from happening. But like, you very rarely see bouncers in certain areas in nightclubs. Some places you do, but a lot of places you don't, especially dance floors, especially by the bars. They're usually on the doors and maybe somewhere else at like a higher point of view where they can see a bit more. But like, I just think in general venues should just like have more awareness, have their staff have more awareness on it. And I don't know, is there a way that people can get tested quickly on the spot if they're spiked? Like when people are drunk, they have a breathalyzer. Like, what can people do? Is there something that someone can come up with or has already come up with that people can check to see if they've been spiked? Like, maybe something like that.
I mean, I wear long sleeves every single time I go out now, and I am more aware of like my drinks and that sort of stuff. I always ask for like a bottle stopper, and I'm always like looking around for like security and that sort of thing. So I guess it has like sort of subconsciously made me more aware of everything. But I don't think it's affected me that badly compared to other people. I think a lot of other people have become very anxious about it. And as soon as they've got spiked, they don't want to go out ever again. Even if there was like a welfare officer or something, just to make sure that they're okay mentally or anything like that, that they're still like responsive. It wasn't any of that. They just told them to leave straight away. But if they just had like another check instead of just a test cup, that would just help so many people.
So to protect yourself against drink spiking, there's some obvious ones. Never leave your drink unattended. You know, I'm a smoker, and I know every time when I want to go outside to have a cigarette, I'm not allowed to take my drink, which in this day and age seems ridiculous. Why don't we just decant it into a plastic glass if they're that worried about someone stealing a glass? And so I just don't understand that. But yeah, never leave your drink unattended. If somebody offers to buy you a drink, go with them to the bar. Say, oh, how kind of you, so you can watch your drink being poured. Don't take a sip from somebody else's drink. And, you know, always just be vigilant. And I don't understand why we've all suddenly got so selfish in this world these days that you say, you know, look out for your friends. Don't just look out your friends. Look out for everybody. You know, if you see somebody doing something untoward to somebody's drink, go and tell the bar staff, go and tell the security staff, tell that person not to drink it. Don't approach the person who spiked that drink, because if they're the sort of person who's doing that sort of crime, they're obviously not a very nice person. So I think, yeah, just to safeguard yourself, just be more vigilant and just try to keep an eye. And if you're going out with a group of friends, maybe, you know, when I was younger, going out partying, we'd have the designated driver. Maybe that designated driver could be the person who's looking out for you all. So, you know, party safely, party hard, have someone there looking out for you. So they've just, you know, isn't it terrible in this day and age? You have to have a babysitter to go out to party. Here we go. But, you know, hopefully with education is key. We've got some protection now. We've got the stop tops that can stop anyone from spiking a drink. There's spikies, which can go in top of a bottle. There's a nightcap, which is like a scrunchie that you can put over a glass. So, I mean, that can help to safeguard you. But mainly, just try and keep alert, or like I say, have a designated person to look out for you.
The hospitals, I think they just need to sort of follow up, or the police need to follow up with sort of welfare checks. I think everyone just sort of needs like a basic level of like education on it, because it's not talked about. If, say, I had like a lecture about it at university, it would just bring so much more awareness on it. And obviously the event that the MP is doing in the student union, where they're doing like a big Q&A and forum about spiking, that's obviously helpful because it is spreading awareness and educating people on it, because people don't know how to deal with it. So if they're educated, it makes it a lot easier. And then I think obviously nightclubs need to make it more secure. I mean, they've started, some of them do like the drink stoppers, but obviously that doesn't really help when it comes to injections. So I think like if they had like drug checks at the door, and I think a couple clubs have like metal detectors, so that would detect the needle straight away, and then just like a quick pat down to make sure no one's got any drugs, like you would at like a concert or a festival. I think that would help hugely, and it wouldn't take that long at all. So I think that would help, just because, and just more security, just looking after people. But yeah, I think that's it.